What neurologic syndrome is due to a lesion at the lateral medulla? Wallenberg syndrome. Suppurative otitis media can cause perforation of what? Can cause perforation of the tympanic membrane. When you're having a discussion with a patient, you should say something like, "It is your decision, but tell me your rationale." How long must a patient typically wait to get a bariatric surgery? 1 year. They must wait 1 year after surgery to get bariatric surgery. If you suspect your patient has a spinal epidural abscess, what imaging should you order? You should order an MRI. Note that you treat choking patients differently, or choking individuals, I should say. Less than or equal to 1 year, what do? Abdominal thrusts or alternating back blows and abdominal thrusts. They're older than 1, you can do that Heimlich maneuver for the most part. When you're talking to your patients, what sort of questions do you want to use in general? Use open-ended questions. So with regards to hazard ratios, there's less than 1, equal 1, or greater than 1. What are the differences? Well, less than 1's protective, equal to 1's no effect, and greater than 1's a bad effect. Greater than 1 is bad for a hazard ratio. Large hazard ratio, bad. What are patients with Tourette syndrome at risk for? They are at risk for ADHD and OCD. How do you treat moderate psoriasis? Topical fluoxamide treats moderate psoriasis. Is a clinical microsystem, sorry, if uh, if you were ever rounding on patients and you have a nurse with you in pharmacy, and you go into the room and there's occupational health there, there's PT and RT, is that all healthcare team rounding a form of clinical microsystem? Yes. So clinical microsystems are like all the people that are involved with these health decisions, not just like an attending telling the residents what to order, but it's a big team and everyone knows what's happening and they round on patients at the same time, kind of. Before prescribing a medication, what should you discuss? Risks and benefits, and also get consent, right? If you have a patient that, like a newborn patient, you want to start thyroid supplementation if necessary. If you have a patient with symptomatic bradyarrhythmias, is it possible that under certain situations a temporary cardiac pacing may be beneficial? Yeah. What's the mnemonic to manage shoulder dystocia? Be calm, and that means breathe, elevate legs, call for help, apply a suprapubic pressure, enlarge the vagina with episiotomy, and maneuvers. What percentage of patients with acute varicose bleeding develop bacterial infections? 50%, right? 50% of patients with acute varicose bleeding develop bacterial infections. So you give them prophylactic antibiotics. A patient in cardiogenic shock will need what? They will need optimization of their preload. Patients with insomnia should be evaluated for what? Psychiatric issue. Depression, right? If depression's noted, in general, how would you treat? With an SSRI, such as citalopram. What is a life threatening? Meh, okay, scratch that. What is a common complication of cryptorchidism? Testicular cancer is a complication of cryptorchidism. In orbital fat tissue, if there's a wound, what muscle is highly likely to be injured? The levator palpebrae. What are common medications for GERD? Proton pump inhibitors. If you have a patient with a QRS complex greater than 160 milliseconds with a left bundle branch block, what do they most likely have? Left ventricular systolic and diastolic function, dysfunction. Left ventricular systolic dysfunction, you'll see a QRS complex greater than 160 milliseconds with a left bundle branch block. So that's severe left ventricular systolic dysfunction. Note that leukocytes in the anterior segment of the eye is iritis. What should patients with symptomatic hypercalcemia due to overproduction of parathyroid hormones receive? A parathyroidectomy, right? If a cat or dog bites a patient, should it be surgically closed? No, it should not. Leave it open. Leave risky bite wounds open to drain. If you have a patient that has Coxsackie A, what are they most likely to have? Herpangina, right? Herpangina is caused by Coxsackie A. Is the direct Coombs test positive in G6PD deficiency? Nope. The direct Coombs test is negative in G6PD deficiency. Note that, in general, you want to inform patients of medical errors and give a sincere apology when those times occur. It's the right thing to do, it's the ethical thing to do, and you're less likely to get sued and have to live on Skid Row under a bridge in Los Angeles or Pittsburgh. A patient with catheter-related bloodstream infection should start vancomycin and cefepime and leave the catheter in place, okay? What sort of imaging modality can help diagnose metastatic bacteremia? An MRI can help diagnose metastatic bacteremia. A patient with suspected central hypogonadism should have an ACTH stimulation test. If your patient's INR is too high under obvious high dose scenario, what should your medical treatment have them do? Obviously slow down with that warfarin intake, right? Hold the warfarin, your INR is too high. What common medication can be used to treat polymyalgia rheumatica? Low dose prednisone. Low dose prednisone can be used to treat polymyalgia rheumatica. If you have a positive Thompson test, i.e., you squeeze a person's calf and there is no extension of their toes, what does that mean? It means the Achilles tendon has been ruptured basically completely. So Achilles tendon rupture, do the Thompson test, squeeze their calf. If their toes don't point, outwards, then their Achilles tendon is ruptured. A patient with high risk for influenza complication needs to go where? To the nearest emergency department, right? In general, you can proceed with a surgery unless health or drugs make the procedure risky, in general. What sort of procedure is used for acute cholangitis in ERCP? True or false? Delirium cannot be caused by vitamin deficiencies. That is false because we know that delirium can be caused by vitamin deficiencies. If you suspect that your patient has superior vena cava syndrome, what sort of test or imaging should you do? You should get a CT scan of the chest and neck if you suspect superior vena cava syndrome. True or false? Blocking the sympathetic activity of someone with thyrotoxicosis may be beneficial. That is definitely true because you don't want them shaking and sweating if you can just block the sympathetic activity so that they're not fumbling around when they're on Iron Chef having to make some delicious French pastry, right? Okay.